We recently traveled to Flint to see University of Michigan School of Public Health researcher Derek Griffith's collaboration with Your Blessed Health. The organization has successfully introduced HIV prevention programs in African American churches, which have historically been resistant to talking about issues around sex.
We've been working with the project since 2006 or 7, and our role has been as the primary evaluator, but in a project like this, evaluator also translates to sort of helping with the development of the program as well. So what, in a broader sense, we've seen ourselves doing is trying to bring some science to the work that she was already doing. What's exciting about a project like this is it's already overcome one of the biggest barriers, which is actually getting into an institution such as a church. And then the question is, how do you build the science around it to help strengthen the impact of the program on youth, on the organization, and on the community?
So I'm Jen Salomone. I work at the Women's Educational Center at the University of Michigan Flint. And our workshop today is It's Complicated, Sex, Love, and Relationships.
Your Blessed Health, 2007 was the pilot. 2008, 2009 was Your Blessed Health 2, 2010 was Your Blessed Health 3, and now we're in 2011, which is Your Blessed Health 4. The pilot and Your Blessed Health 2 really was more about changing the environment within the church to make it normal for young people to be able to talk about sex and sexuality. And it was also to reduce the barriers of working cross denominations, because Your Blessed Health is 55 churches that consist of 9 denominations. It's been really, really wonderful. We've seen not only how it has been able to change the culture within the churches, but it's changing the culture in Flint in terms of how we work with our young people around sex and sexuality.
How I got involved is in my 10th grade year, my friend asked me did I want a job because he had worked with them and he said it was a great experience. So then we went to the training. First we had to take a test. And when we take the test, we all have a big discussion over it about HIV and how we thought it was transmitted and how we thought what was it to us. HIV or AIDS, only a doctor can diagnose you with it. So, see, I didn't know that.
The way we measure success in a program like this is really to start to think about what are the appropriate measures, metrics of success within these kinds of interventions. One of the biggest challenges is that it's very difficult to even just ask direct questions about sexual behavior within this kind of setting, because usually you're dealing with relatively small numbers. So it really does mean looking at other types of things like the organizational context, the capacity of leaders, the ability of the youth to feel comfortable talking about these issues.
The parents were very receptive to it. We also taught a class to the parents so that they would understand what we were teaching them. Church is not for just the people right inside, but it's for the whole community.
We definitely have been approached by folks from across the nation around this type of project, and the application is simply it's difficult to figure out how do you find an appropriate message that's consistent with a public health focus and approach of trying to reduce HIV risk and sexually transmitted illnesses within this youth population, as well as trying to equip faith organizations, faith leaders to address these issues. Certainly being able to equip that type of institution with the skills, the knowledge, the capacity to address something such as HIV really does bode well for our ability to address this epidemic within the community.